This is a Traumeel injection. This is a very unique thing that I do that nobody else does. This is interstitial tear of this Achilles tendon. It always tears about 5 to 7 centimeter above the insertion site of the tendon because that's the weakest part of the tendon. So patient comes in with a lot of thickening of this area, very painful, burning pain. So there's a lot of scar tissue embedded in this tendon because of the tear. So we break down the scar tissue utilizing the Traumeel herbal injection because the cortisone injection can literally rip this whole thing apart. So we cannot use cortisone, so only option we have is a Traumeel injection. Physical therapy, stretching, massaging, all those things help, but it's most effective with this Traumeel injection. So I already numbed this area, so I'm going to inject from either side to break down the scar tissue, which will soften the tendon and get this tendon back in order. Okay? It may take up to 3 to 5 injections to soften this whole thing, which we do this every 2 weeks or so to soften up this whole thing while they're getting the stretching and also physical therapy done at the same time. Injecting right along medial and lateral side of the tendon where the scar tissue is. So I already marked the area where the injection should be. So I'm injecting right into the tendon to soften up all the scar tissue that's on this particular tendon. And we call this interstitial tear because all the tears done in the tendon itself, not like the end-to-end tear, but it's inside the tendon. So we call that interstitial tear of the Achilles tendon. So I did it from the lateral side. Now I'm going to go from here and inject this side, and it's very effective. I've seen a lot of athletes, I've seen a lot of soccer players, especially volleyball players. A lot of side-to-side motion as well as the explosive motion can tear this tendon internally, and it's quite devastatingly painful. It takes a long time to get better, and with this injection it will be able to help get it better much faster.